The only downside is you can't drink coffee. Raleigh, hello and welcome to Monday's edition of Your Backyard. Once again, we have our friend, our mentor, our doctor, Dr. Susan Lovelle, to talk to us today about the COVID-19 quarantine. Thank you, Dr. Lovelle. We appreciate you.
I love being here.
Well, you're a great voice of reason. I wanted to start out. Jonathan, who's behind the scenes, shared some information about the NFL and the disastrous things going on there. Are
Yeah.
you familiar with that?
Yeah. So as a sports fan, we were kind of really looking forward to the sports getting back out there and we're seeing them start. But the NFL and the MLB, so baseball and football, have decided to have a more open way of managing games. So even though people aren't in the stands, their players are traveling from town to town. Now, when they get home, they're supposed to quarantine and everything. On the other hand, soccer and basketball have got that whole bubble thing that we talked about a
Right.
couple of weeks ago. So what we just heard this morning from Jonathan was that the Marlins have about 14 people on their team who have tested positive. Their opening day is now canceled. And the Yankees, my team, have also canceled their game. They played a couple of games, but they've just canceled some. So what we're seeing is that idea that we can just travel, even if it's a single group, when people are going home, who knows what's happening. So yeah.
Well, I certainly understand the bubble. We're going to protect, we're going to limit the number of people who get to interact with our team and our this very specified group. I didn't really get what NFL and baseball are doing. We're going to keep everything the same. Just be careful.
Right, right. And even, because we were watching games, my husband and I were watching games this past couple of days, and even on the team, some people had masks, some people didn't have masks. They had some people, sitting, they would have the players sit far apart, but, when they're on the base, I don't know, I don't understand. But, we're seeing some changes there that may not be as good as what we'd like.
Once again, further evidence that if we would all take the three simple precautions, we could nip this. But if a significant portion of people are going to devil may care, I certainly don't about the mask. We're going to continue to see this. Um, we also mentioned that there was a huge bipartisan support for masks, but
Hmm. Yeah, I was going to say, I was going to absolutely agree with you. And I think we're seeing that more and more. People are realizing that it really isn't that horrendous a thing. The one thing that I would say, though, is that I have seen a lot of people, even though they have a mask on, they're not wearing them properly. So, would you demonstrate, Robert? There you go. See? Tight to the face, above the nose, not under the nose.
that is my favorite. How y'all doing?
That's
You doing
that's
all
not
right?
doing. That's definitely not doing it. So,
Um,
yeah, exactly.
Thank you.
Uh-huh.
So masks are super important, and washing your hands and keeping a safe distance, and we can get this back into control.
Hmm.
Um, and I'm not going to go on about masks. I'm so frustrated. Um, but you came with some special news, a couple things that you wanted to specifically run by us today,
Yeah,
Dr. Bell. Will you share that with us, please?
sure, sure. Just four little points that I wanted to carry today. So the number one thing is testing. There's still a lot of, back and forth about whether it's necessary, whether it's a good idea, whether it's a bad idea. But here's the science behind it. With
Mm,
increased testing, what we're seeing is yes, the number of cases go up. We shouldn't be that concerned that the number are going up because we're testing more. What we should be concerned about is whether or not the virulence factor is being
mm,
borne out. And so in the beginning, we thought that COVID-19 was horrendously, I mean, very easy to catch, easy to get a bad case. But now, as we have an expanded number, the number of cases in that larger number is less. So it's not as virulent as we thought it was, even though it
mm.
is, it is infectious.
Right,
It's not as bad as we thought. So it's not a bad thing to test.
right, and it's just getting data.
Exactly.
Uh,
Exactly.
So testing is a natural point. It's the data we need. Of course, there's going to be more cases discovered when you test. That's
And
the point.
that's not a bad thing. We just need to recognize that. The second thing is also related to that testing, and what we're seeing not only here in North Carolina but across the nation is the fact that minorities are being much more severely impacted by this disease, and there are lots of reasons behind that. And maybe at some point we can unpack that as well. But especially here in North Carolina, the Hispanic community and the Black community have much higher rates of both the presentation of the disease and also a more severe presentation. So, of course, associated deaths, to the point where the Department of Health is actually starting to put out information specifically in Spanish to get to that community as well. So that's something that we all need to be aware of, and especially as it hits us now.
Right, and share that. I would love to unpack a little further on this point in a show or two in the future. So,
Yeah, there's lots going on there.
right.
Yeah. The third thing I wanted to talk about was that the fact that we do have a specific dashboard now for North Carolina. So if you're, interested in what that is, it's by the North Carolina Department of Health and Hospital Services, something like that. And I think Jonathan was going to put that in the chat so you can see that actual link. But it's allowing us to actually see. Oh, thanks. It's allowing us to see, specifically by zip code, what's going on, where there are particular outbreaks and things, just to, again, give us more data so that we can make informed decisions.
Well, thank you, Dr. Lovelle. We just mentioned that last week, and you found this wonderful dashboard with a lot more data, really right here in our backyard, literally.
Exactly. Yeah, I pulled up mine. Yep.
Well, data. We seem like we have a lot of data. What do we do with it?
Okay, so that was actually my fourth point. Thanks for bringing that up. The fourth point is don't live in the data. Look at it maybe once a week, but don't keep don't keep rehashing it. Whether the numbers are going up, whether they're going down. Take a look, take a snapshot, and then get on with your life and do the things that we know are already working. We know that miring ourselves in things that are negative, that are stressful, actually lowers our immunity. So by doing that, you're actually, harming yourself. Not only does it not help, but you're actually harming yourself. So look once and go on with life.
The data associated with good habits and a plan, right? It is safe to go to the grocery store if you do it properly, right? So data should just be a part of your plans and habits of success for this.
Absolutely.
What do you have some upcoming immunity and other health-related seminars we would be interested in, Dr. Lovelle?
I do them on Tuesdays, 7 p.m. tomorrow.
Well, Dr. Lovelle, thank you. You are always an inspiration for us. And Raleigh, I want to remind you that Dr. Lovelle's not just here to give us our COVID update, which she so graciously does every week, but she's here to help you. She has the opportunity, if you want to boost your immunity or any other great services she offers, please check her out at Premier Wellness. Any last words, Dr. Lovelle?
I think not. I enjoy being here, enjoy you, and love being in the backyard.
Oh, thank you. Well, we're very lucky to have you right here, Raleigh, in your backyard. Join us again next week for another Dr. Lovelle COVID-19 update.
Thank you.